Hello and welcome back to Finding Your Unhappy, Unconventional Pathways to Mental Health and Happiness. I'm your host, Ilana Davidson, author of Finding Your Unhappy, The Soul Searcher's Guide to Peace and Happiness in Everyday Life. And we are here to have a conversation about unconventional pathways to mental health and happiness, as we are every week. This week, we will be talking about the subject of psychological injury. And I have a very special guest that is going to join us today to talk about his work in this field. Dr. Eric Kolker is a PhD and is the practicing clinical psychologist. He's the only psychologist in Canada to publish aggregate data on how his clients progress in therapy. His work has been featured in TEDx talks, TV programs, books, and newspapers. And he's here to talk about his findings, his work, and his perception on mental health. And I'm super excited to be having this conversation with him and to learn from him and his research and his understanding. So I'm going to bring him on to the show. And so without further ado, here comes Eric.
Okay, thank you very much for that kind introduction.
Yes, great to have you here. I'm really looking forward to this conversation.
Mm-hmm.
So can you just say, for our listeners who maybe never heard of the concept of psychological injury, can you just unpack that for us a little bit, help us understand what we're talking about?
Okay, I actually believe that there's sort of four major groups of psychological injuries. And the first one is trauma or neglect that happens in childhood. And so this whole area got kicked off back in the mid-1980s. There was a physician in San Diego. He's running an obesity clinic. And people would come in, they'd be like 300 pounds, 400 pounds. And he would help them to lose weight. And which was great. You know, they would drop 50 pounds, 75 pounds, 100 pounds, and then they would just ghost. They'd be gone. And Dr. Felitti was really puzzled, like, what the heck is going on? I mean, these people are losing weight. They're improving. And so he's very puzzled. And he asked a lady one day the wrong question. And he asked her, when he was interviewing her, how old were you when he first became sexually active? And she said 7 years old. And he said, what? And she said, yes, I was 7 years old when my father raped me for the first time. And he was blown away, because Dr. Felitti had been taught that incest was extremely rare, happened only in 1 in a million households. And so he was just blown away. Here's one of his patients telling him that she'd been sexually abused. And so he went back to this group of people that he was working with to help lose weight. And he started asking them, have you guys ever been sexually abused? Now, this is 1985, right? This is before Oprah really opened the conversation on sexual abuse and childhood abuse. This was not talked about in the mid-80s. He was studying. 2/3 of the people in his weight loss group had been sexually abused. And that really triggered him to start asking about childhood trauma. And so he ran a big study, and they asked people whether they'd ever been physically abused, sexually abused, emotionally abused, whether they'd been physically or emotionally neglected, or if they had a parent with a serious mental disorder, a substance abuse problem, a criminal, if there was ever violence between the parents, or if they're separated from a parent before the age of 18. And so these were 10 common childhood adversities that people experienced. And so now this was in San Diego, remember? Now, Ilana, how often have you been to San Diego?
I don't know if I've ever been to San Diego, actually.
Really? Yeah. It's a really nice city, right? beautiful surroundings. There's Mercedes crawling through the streets. It's affluent. It's beautiful. They didn't expect much out of this sample of people when they asked about all these childhood traumas. But when the data came back, they were absolutely blown away. 2/3 of the people had been traumatized in some way in childhood or emotionally neglected. 2/3. And what that means.
I have actually a curious question. I'm just going to pause you for a second, which is, do you have a definition of trauma and what trauma means?
Yeah. And in this case, they asked people and they had specific questions that they used to assess these childhood adversities. And whether the person was physically abused, sexually abused, or emotionally abused, called names a lot, whether they were physically or emotionally neglected, or whether they had a parent with a substance abuse problem, a serious mental disorder, criminal, violence in the home, or separation from a parent before the age of 18. And so
those kind of all fit in what is considered trauma?
Well, one category is neglect, where the person is simply ignored. And, I've had clients tell me, I never, ever felt like my parents cared for me. The parents didn't beat them. The parents just said, here's your food, here's your clothes, go to school. The parents never hugged.
There was like a lack of emotional warmth or emotional connection and that sort of bonding experience.
Absolutely. Yeah.
Because something that I run across, and I'm curious to see how this fits in with what you're saying, is that, like, in my childhood experience and then some other people, it's like I wasn't sexually abused. I didn't have a drunk parent. I didn't have all of these things. And yet through years of my life, it's become clear that I do hold childhood trauma, but there wasn't like one specific event that I could point to that like really stood out. So I'm just curious about that, because there's a lot, I think now we're many decades from the 80s, and childhood trauma is something that's fairly well, I think, acknowledged and recognized. And yeah, I think it's the scope in which what we consider as traumatizing is, like, maybe in my view is too narrow. There's a whole bunch of other things that kids experience that leave those impact and those marks that have long-lasting effects in their lives.
And one of the things that those 10 questions did not ask about was bullying at school.
Right, exactly. And that's one of, if I had to think about it, I had a loss, I had emotionally unavailable parents, I was bullied. And so I think in some of the stuff that I've heard you talk about is like the cumulative effect, right? So one piece of those in and of itself might not seem like that big of an event, but when you add them all together, they can have maybe a psychologically injuring effect on the person.
Exactly. And what they found was they looked at women who were mid-50s or that sort of stuff. Now, if a woman grew up in a home and she reported none of these painful experiences in childhood, her chance of developing depression by her mid-50s was 18%. But if she had just one of these negative childhood experiences, that went to 26%. If she had two, that jumped to 33%. Well, two traumas, and she's nearly doubled her risk of developing depression.
So that percentage is sort of in relationship to the general population. Is that what we're talking about?
The women who had no traumas, only 18%.
Compared to the women with no traumas, that's where the percentage is.
Yeah. And if she had three traumas, then it jumped up to 45%. And the
Mm-hmm.
poor women who had 6 or more traumas, 61% of them experienced depression by middle age, compared to
Mm-hmm.
the women who had 0 traumas, only 18%. So they were 3.5 times more likely to develop depression if they had multiple childhood traumas.
Mm-hmm. So basically, the sort of the first category of psychological injury is childhood trauma.
Mm-hmm.
And so even just with that, so we're just talking about, you said there's 4 categories. We're talking about one.
Yep.
And within the first category, depending on your level of trauma, you're 60% more likely than a person who's experienced no trauma to suffer from depression.
Actually, it's a lot more than 60%. It's more like 300% more likely.
Oh, okay.
Yeah. So it's really astonishing. And this is across it's across every single mental health problem that I've looked at. The only exception I've found so far is autism.
Mm-hmm.
So
Mm-hmm.
here in Canada, they did a study with 23,000 people, and they only asked about 3 traumas. One was, were you physically abused? Were you sexually abused? Was there violence between your parents?
Mm-hmm.
So they didn't ask about 10, they just asked about 3. And if a person had no traumas, then their risk of bipolar disorder was set at, 1. But if they had
Mm-hmm.
just 1 trauma, their risk of developing bipolar disorder was 2.5 times greater than the people who had no traumas.
Mm-hmm.
If they had 2 traumas, then their risk of developing bipolar disorder was 5 times greater than the people with no traumas. If they had all 3 traumas, if they're physically abused, sexually abused, and if there's violence between their parents, they were 8 times more likely to develop bipolar disorder than somebody who grew up without those psychological wounds.
That's pretty phenomenal. And especially in a world that thinks of um, bipolar disorder as um, sort of more of this condition in your brain, or there's a lot of people that say, they don't associate things like bipolar disorder with trauma.
Yeah.
Um,
Yeah.
and so, yeah, that's fascinating. We actually have a question from one of our listeners that I want to bring in that I
Sure.
think is of value, is how can we intervene for our kids who are exposed to trauma? And so, I mean, some trauma is, maybe preventable or avoidable. And sometimes traumas just happen, like a sudden death, or just there's certain things that are inevitably out of our control in life. And so, so if you or your kids, let's say you have a kid that has had to go through a traumatic event, what is some of the ways that we mitigate that long-term impact on those kids?
Yeah. That's an incredibly good question. The first thing to do is to just validate the child's pain.
Mm-hmm.
Because I've had clients come to me and they went to their parents and they disclosed that they were sexually abused. And their mom just screamed at them, "Don't dare say that about Uncle Wayne. He would never do that to you." And the child's like,
Mm-hmm.
you know, and the mother's disbelief and invalidation of the child's pain, decades later, they're sitting on my couch, they're sobbing. They say, "That was worse than Uncle Wayne molesting me."
Absolutely. I mean, I've heard that over and over again from my clients, is that yes, the thing that happened to them was traumatic, but the fact that nobody intervened, nobody was there to support them, they weren't allowed, they weren't allowed to have an emotionally appropriate response to what happened to them.
Yeah.
And then so that thing gets frozen, or there's a self-blame that happens. Today, actually, I was just talking about, I don't know if you're familiar with the work of Alice Miller. But she talks a lot about the importance of having an empathetic presence in your life, a caring adult that can give you the space to have an emotionally appropriate response to what happens to you. And I really think that that's part of the healing, and that when you don't get that, it can create all sorts of places where you get twisted up, or like this cognitive dissonance about what's really happening. So I so agree with you that holding a non-judgmental, caring, empathetic space can go really a huge way to in sometimes making the difference between whether or not something is a traumatic event in the moment and whether something is a lifelong traumatic event.
Yeah.
If that makes sense.
Oh, totally. One time I was interviewing the client, the daughter of somebody and of a criminal. And this criminal had sexually abused her for 8 years. And I was just gathering data. I was doing a risk assessment. And finally, I spoke to this young woman and I said, you know, you are really psychologically healthy for going through 8 years of abuse. And, you know, do you mind me? You seem really psychologically healthy for going through such a terrible experience. Do you mind telling me about it? And she said, yeah, my aunt was a social worker and I could tell her anything. And it just was so remarkable that being able to talk to her aunt in real time and have her aunt validate her emotions really, you know, facilitated healing from her stepfather sexually abusing her for 8 years in a row. So that, you know, validation by parents and acknowledgement that the child is in pain and the child can talk about it.
Yeah.
That's very helpful in offsetting it.
What's your, while we're on the subject, that's this kind of related question of your understanding experience of gaslighting and kids sort of being gaslighted, because that's something that I come up across is sort of it's kind of what we're talking about, is the invalidation of someone else's reality, of the child's reality, and how that affects your sense of trauma and your experience.
Yeah. Yeah, because, you know, in the trauma, the perpetrator is just does not in any way consider the child's feelings. The perpetrator just does exactly what they want to the child, right? Whether it's Uncle Wayne sexually molesting his niece, whether it is a hypercritical mother, you know, shredding her son's self-esteem by telling him he's just as much of a failure as his father is. The perpetrator just is focused on what they want and not at all about how the child feels. And so one of the things that's very healing is when somebody experiences somebody else listening very attentively and really empathizing and acknowledging how the person feels about their psychological injury.
Right. Absolutely. I've seen that and experienced that. It's like that again, I come back to, are you allowed to have an emotionally appropriate response to what happened to you? Or it's like you're even like something as simple as your grandma dying and your mom tells you not to cry about it and don't cry and like suck it up, then you've just kind of been invalidated for your emotional experience, and that can get internalized for a really long time.
Yeah. Yeah. So childhood trauma has a colossal impact. And, you know, every major mental disorder, the more trauma that people go through, the higher their risk. So even schizophrenia. And they did a study in the US, then they did the very similar study in the United Kingdom. They found that if people had 5 childhood traumas, in one, you know, I think in the US, they were 63 times more likely to develop schizophrenia. And in Britain, they were 160 times more likely to develop schizophrenia.
And that's, you know, when I listened to your show on that Mental Insights podcast, that's something that really stood out to me and really resonated with me. It just fits with my experience and my intuitive sense that these mental health experiences actually really have to do with trauma. And yet it's not something that's talked about a lot, right? Schizophrenia is a disorder of the brain, and bipolar is an disorder of the brain. I mean, that's the kind of the common wisdom, right? Or I shouldn't say wisdom, the common perception. And yet what you're saying, and it fits with all of my lived experience, that these things are often a result to some degree of traumatic events in one's life.
Oh, it's not just, it's a colossal result, right?
Mm-hmm.
There actually
Mm-hmm.
is not one single study. There's not one solid scientific study that shows that anybody has a chemical imbalance in their brain.
Mm-hmm.
And, you know, Alana, I'm sure that you have an exciting social life and you get invited to parties and that sort of thing. I don't. I'm a really boring guy. You know, like, notice the time.
Okay.
I stay home on Saturday nights and I read psychiatry journals, right?
It kind of sounds fascinating, actually.
And I can tell you very, very confidently, there's not one study indicating that schizophrenia is fundamentally a chemical imbalance or that it's a brain disease.
Right.
Now,
yeah.
Some people say, oh, well, people with schizophrenia, they have problems in, you know, the left hippocampus is smaller. And that actually is true. When you do brain scans of people with schizophrenia, the left hippocampus is smaller. However, Dr. John Reed at the University of East London, he said, that's exactly what happens to traumatized children. And every single structural abnormality, right? Like the ventricles in the brain are larger in people with schizophrenia. And Dr. John Reed pointed out, well, yeah, the ventricles in the brain of traumatized children are larger.
So there's that direct correlation between the two, and the same thing is happening to the brain in both cases.
Yeah. And all the people I've talked with who hear voices, who have odd experiences, who have intense negative mood, you know, the cluster of things that we call schizophrenia, lo and behold, they have lots and lots of trauma in their childhood. So, you know, childhood trauma, like, you know, learning disabilities, anorexia, you know, oh my gosh, if you had all three traumas, you were 11 times more likely to, you know, develop anorexia than people who grew up in emotionally healthy homes. By far and away, it's the single biggest cause. But that's just one of the 4 groups of psychological injuries.
So here's it. Actually, before we go on, I just want to say, if you're listening and you have any questions that you want to address in this conversation, please put them in the chat box. We'd love to hear from you. Do you have an experience with a mental health issue that maybe relates also to your experience of trauma? And what's been helpful for you to navigate that? And then on the flip side, what I've kind of come to think about is, first I indicate, or how do I say this? I recognize that my mental health issues and my upsets are indication that I had trauma, even though I maybe don't remember the trauma or wasn't really aware of it. It's like, oh, I have all of the signs, like the way I'm presenting, the way my feelings come up around a certain issue, to me say, okay, there was something that traumatic that happened there. Because if it hadn't, I wouldn't be having this kind of experience right now. So that's sort of like flipping it around on its head to say, if And I wonder what you think about this. Like, so if you're struggling with depression and some major mental health stuff, the likelihood then that you had some trauma that maybe you don't remember or didn't identify or don't really understand is far greater. I wonder like what you think about that.
It's quite common for people to not recognize or not acknowledge,
Mm-hmm.
right? I remember working with one guy, and he, told me that he had been sexually abused by a
Mm-hmm.
pedophile when he was 8 years old. And I said, well, how did you feel about that? And he said, well, I deserved it. I'm like, what? And he said,
Wow.
yeah, I found half a packet of cigarettes and my parents told me not to smoke it, but I went out in the woods and I smoked it. And when I was in the woods, this guy came along and sexually abused me. And
Wow.
he didn't even recognize that he had been traumatized by sexual abuse by a homosexual pedophile. He
Mm-hmm.
thought he deserved it because he was smoking cigarettes when he wasn't told to, when he was told not to.
Yeah, it's so interesting how the child brain will weave these crazy logics about life
Yeah.
just to try to navigate. And like in my case, I was told my whole life like I had a wonderful childhood and I had a wonderful place to grow up. And so and I had this incredible cognitive dissonance my whole life because it didn't feel wonderful to me. So of course I thought I was the problem.
Yeah.
And it's only been, in, probably my 30s is when I started to really unravel and say, no, there were some really important key pieces that were missing that I needed as a kid that I didn't get. And that's partly why I've struggled with depression my whole life.
Hmm.
It wasn't until I really came to own that and to own, like, no, I didn't get what I needed as a kid and it wasn't my fault. And I have a right to be upset about it because that was the other thing. Like, not only did I have these traumatic experiences, but because everyone was telling me everything's fine, I wasn't allowed to be upset about the things I didn't get.
Yeah.
And so to move into that place of being able to even just what I could think of as mourn and grieve the fact that I didn't get my needs met, like that was a huge piece because up until that point, my parents couldn't acknowledge that they were anything less than wonderful parents. And
Mm.
so I could either disconnect with them and say, no, you're wrong. But it took me until my 30s where I was okay to do that because I still felt that psychological sort of need for them, if that makes sense.
Yeah. Yeah. So, we looked at childhood experiences are a colossal source.
Yep.
And now some people do grow up in emotionally healthy homes and they do
Mm-hmm.
develop serious mental health issues.
Mm-hmm.
Um, I'm not saying that it's the only cause, but,
Mm-hmm.
it's by far and away the biggest cause. You know,
Yeah.
when you have people with 3 childhood traumas at 8 times the risk of developing bipolar disorder, that's a massive factor.
Right. And it seems like a massively unacknowledged and overlooked factor because I don't hear anybody, or aside from you and a couple other people, talking about how bipolar is linked to trauma.
Yeah. And, the message always is it's a chemical imbalance. And, some people sometimes find the medications helpful in, kind of moderating their symptoms,
Mm-hmm.
but it's not fundamentally a chemical imbalance. All the clients I've ever worked with bipolar disorder, you know, dad was a violent alcoholic. They were sexually abused. Mom was severely depressed. The parents split up. You start talking to these people, and it's like, by golly, there's a whole, childhood history of tremendous pain.
Right. So those are all the psychological injuries, all of the harm that was done to your well-being, to your psyche, to your sense of self, to your sense of boundary. those kinds of things.
Yeah. Yeah. So that's, neglect and trauma in childhood. That's the first major group of psychological injuries.
Mm-hmm.
The
Mm-hmm.
next major group is reporting to a toxic boss.
Oh,
And
interesting.
yep, um, every single week, it was like clockwork for 20 years. Every single week, brand new client will walk in my office. They'd tell me that they were crying. They would wake up at night and quiver. They wanted to die because they were in so much emotional pain. And I'd say, wow, that's really distressing for you. What's going on? And they say, well, I think it's my boss. I go, oh, can you tell me about it? And so, Ilana, I tell you, I've got hours of these stories. I have so
Mm-hmm.
many of them, and I heard it so often. I actually developed this 14 module video course, How to Recover from a Toxic Boss, because I just kept repeating myself. And I'm like, am I in a rut? Like, I keep on saying the same thing to everybody, but by golly, um, it just kept on occurring. So, for example, one person had just gotten their professional accreditation, right?
Mm-hmm.
So they had just gotten certified as an accountant, or they just got certified as an engineer, something like that. So they're 24 years old. They just got their professional accreditation. Their boss walks into their office. They knew they just got their professional accreditation like 6 months earlier. Boss
Mm-hmm.
walks in the office, slams a file down on their desk and says, "This is worth $21 million. Don't F it up." And, the client just went into shock. Because listen to all the
Right.
messages. This is a colossally important project. You are totally expected to handle it all on your own. I will not coach you. Failure will be catastrophic. And so she comes into my office. She's sobbing. She's crying. She wants to die. She's in so much emotional pain. And then
Mm-hmm.
she says this thing that every single person always says. 100%. I've discovered perfection, Alana. 100% of the people who've been psychologically injured by toxic boss say this to me. They all say, I shouldn't feel this way.
Mm-hmm.
I shouldn't feel this way. And I said, okay, you hired on at this firm. How long did the person before you last? And she said, oh, 10 months. How long did the person before that person last? 14
Mm-hmm.
months. How about the person before that? A year. Like, okay. So for the previous 3 years, the person in your position, they just got their accreditation, they hired on at that firm, and they were flamed out in a year. 3 years in a row. And, if they couldn't handle it, why do you think you should be able to? I mean, they were just as
Right. And that,
hardworking as you. And
yeah.
so that kind of took a bit of that false guilt off her shoulder that I should be able to
Mm-hmm.
handle,
And
this.
that with something that I talk about in my book is like, are you having an emotionally appropriate response to the context or condition that you're in? And have you internalized it and made it your fault, right? So somebody is being really hard on you, and now you're blaming yourself and saying, I shouldn't feel this way. It's something with me. It's my own shortcoming. Rather than
Yeah,
saying, that person is being a jerk, and I'm not going to put up with jerks.
yeah,
And I see that over and over again, is this sort of internalized, like when somebody's abusive to you, internalizing it and saying, what's wrong with me and what's my problem, versus, hey, that's unacceptable to me. And like, I think there's a thing in our culture that prides sucking it up, prides being able to stick out tough situations, and that like the world is cutthroat, and you just not cut out for it if you don't keep up, or you don't, you can't hang. And that's such a destructive viewpoint. And yet the people that are willing to take care of themselves and willing to respect themselves are often thought of as weak, or there's just such a huge culture of you have to sacrifice yourself to get ahead and to survive, including putting up with toxic bosses, right? And so, of course, it would come back to that person being like, I don't want to live anymore because I can't take this, but it's all my fault because that's what our culture has told us.
Yeah. So there's one question you need to ask yourself, and it's the single most important question. On a scale of 0 to 10, where 0 is absolutely no trust and 10 is total trust, how much do you trust your boss? And if the answer is 0 to 2.
So trust is a huge factor in determining whether or not it's a healthy workplace.
It's the single most important question. It's not about workload. It's about trust. If you trust your boss 8 out of 10 and the workload's really heavy, you'll be fine. Now, as long as you tell your boss, look, boss, I can keep this pace up for a couple of months, but you got to take some of this work off my plate. You'll be fine, right?
So basically, you trust your boss to, it's like trusting your boss to have consideration for you, or to, like, what are you trusting your boss for?
Several things. One is to treat you with respect.
Okay, yeah, that would be a big one.
Yep. Have consideration for your needs, to say, look, I know that you've been working super hard for 6 weeks. You got 2 more weeks of this, and then tax season is over, and then I don't want to see you in the office for a whole month. Go goof off. You've worked extremely hard. That's a boss who's considerate of your needs, saying, yes, you've been working super hard.
The ultimate.
Yeah.
For me, that's sort of the ultimate, is like, does my boss care about me and my well-being?
Yeah.
And I've heard that before. I think that's a big thing. Like, that's in every social setting, that's the fundamental question, is like, do I matter? And do my needs and my well-being matter?
Yeah. Now, if the answer to that question, on a scale of 0 to 10, how much do you trust your boss? If your answer is between 0 and 2, run, sprint, flee.
Yes.
I have never, ever seen a client be able to return to work and stay at work under a boss they fundamentally distrust. They are in so much, because there's this undercurrent of constant fear. What will my boss do next? What lie will he tell next? What, toxic thing will they say to me next? What, will they...
I equate it with being in an abusive relationship, where that experience of walking on eggshells and not knowing how the person's going to react, and fearing that unpredictability, fearing for your safety.
Yep. So that's a second major category of stressful life of psychological injury, is a toxic boss. The third one is trauma in adulthood. So I work with a fair number of police officers, firefighters, and, so even if you grew up in an emotionally healthy home, if you start working as a police officer, you see some terrible things. And you get called to car crashes, and one of the victims has had their arm ripped right off. And, so first responders, they're often exposed to very traumatic events. People who are in combat, the Canadians in Afghanistan, they were exposed to some really heavy combat in Afghanistan. And they developed a lot of post-traumatic stress disorder. And there was 3 times as many Canadian soldiers died of suicide in Canada compared to died in Kandahar province in Afghanistan.
Right, because
So,
the impact of those traumas is so great.
yeah,
Another example would be, so for some reason in the last week, I've spoken to 3 different women who lost children. And so that is an example, to me, that's an example of an adult trauma that, may or may not have had anything to do with you. It's an accident, whatever. So that's another thing that can be hugely traumatizing. Or
that
losing your husband, a death, something like that.
that grief is extremely powerful. And so the fourth major category of psychological injuries is stressful life events. So, having your company go bankrupt, all the people who used to work at Enron, their company abruptly goes bankrupt and now they're out of a job. Or as you said, Ilana, the death of a family member, a major conflict with a close family member. And there was a huge study where they followed 5,000 people for 12 years. So massive study. And what they did was they asked people, did your depression just sort of come on you out of the blue, or was there a specific event that happened? And 88% of the time, people said there was a specific event that kicked off my depression. There was a serious romantic loss. I had a major setback in life. I had a major conflict with a family member, serious health concerns. I went through a cancer scare. And that shows once again that it's psychological injuries like that, these very stressful life events that kicked off the depression. It's not fundamentally a chemical imbalance, right?
It didn't just somehow start. And that makes so much sense to me. And I imagine for this percentage that didn't have a traumatic life event, I imagine that even for some of those people, and especially in my work, I work a lot with the subconscious, is that sometimes things happen that you haven't even been willing to acknowledge as traumatic, and that's kicking you into a place of depression. So I think there's probably a few people that didn't report an event, but that's because they're just not maybe seeing it as such, right? They're like, well, that's normal. Everybody goes through that. So no, nothing happened. Nothing weird happened to me. And yet very likely it did.
I've got a decent number of clients who come into therapy in their mid-50s. And they say, I just am getting more and more depressed and I don't know why. And I ask, was there a particular event, that happened in the last couple of years? And they said, no, the kids are grown and they're fine. And, and I say, well, so they can't point to a specific stressful life event, right? And I say, well, what about your childhood? And they say, oh, that stuff is all in the past. Like, well, what stuff? Well, dad was kind of hard on me. How hard? And now all the stories of childhood trauma comes out, right? And what they've done is they've just focused so much on career and kids and, paying off the house. They distracted themselves by focusing on these, get ahead in the job and have the kids and raise the kids and get them into university. And now that, life has settled down and they've mastered their job and the kids are fine. Now they've got kind of this bandwidth, this emotional space, and all these painful memories from childhood are starting to come forward. So, yeah, you're right. Some of that 12% of people who don't have a specific life event, it may be that there was other, now the pain was kind of coming to the surface and poking its head up and saying, there's some major problems going on here.
Right. It's like all the things that you avoided for so long, and I can imagine even for people in life transitions that have put a lot of significance into maybe motherhood or their careers or things like that. So the life event is not necessarily traumatic, but you have these changes in your life and then you're starting to feel depressed, which is like a normal change, but because of all of the meaning that you've prescribed to it, then that is a big change and you're having to rethink who you are as a person.
That is, yeah, that's totally spot on. I mean, I see that around retirement.
Yeah, exactly.
If
Mm-hmm.
you put so much of your self-concept into your work, I'm a police officer, I wear this uniform,
Mm-hmm.
and then you retire, then you become a nobody.
Right.
And
Or when your kids are grown, if you're a mom and like your identity is wrapped around being a mom, then it's like it can be very unmooring to lose that and to be like, wait, who am I now?
yeah, yeah. So those are, some of the multitude of reasons that people develop, significant negative mood, uh, very odd thoughts, very catastrophic thoughts like I'm going to die. You
Mm-hmm.
might develop perceptual disturbances like hearing voices. And overwhelmingly, it's a result of these psychological injuries.
Mm-hmm.
And for all the
So,
listeners, you can go to psychologicalinjuryindex.com.
and we'll put that in the comments when I get off the call. So you
Yeah,
have that. Yep.
yeah. And then you can download that index as a way of, just going through it and saying, well, what were some of the psychological injuries that may have happened to me?
Mm-hmm.
And now this is a completely different way of thinking about mental health, right? Instead of this diagnostic category of, obsessive compulsive disorder or
Right. Do I have
borderline.
this disorder?
Yeah,
Mm-hmm.
right. Because I'm a clinical psychologist. I can give people these diagnoses, but you know what? They're not that helpful, right?
Not at all.
In the first place, they're not reliable. You get,
Mm-hmm.
two different clinicians interviewing the same person, they'll come up with different diagnoses.
Absolutely. Yep.
And what do you do with these diagnoses, anyways? What is infinitely more helpful from a clinical perspective when I sit in my chair and I look across my coffee table at my client is, what have you been through? Not what
Mm-hmm.
is your label, but,
Right.
you know,
That human experience, right? That human connection.
yep,
Susie says divorce can create that too. So divorce would be considered a traumatic life event in adulthood, so to speak.
that would be a really stressful life event.
Yeah, I mean,
Um,
some people have amicable divorces, but for a lot of people, that is super traumatic and super challenging. And so, um, just along the lines of like mental health disorders, I wonder if you have a sense of like, in some way, it's like the like hearing voices or bipolar, all that kind of stuff. My view is, and I'm curious what you think about this, in some way, that is a person's attempt in some way to cope with what they're going through. And
I
it's somehow a coping strategy is the best that I can see it, especially disassociating. You're trying to
dis
get away from the pain, right?
oh, disassociating is definitely a coping mechanism to block yourself from the pain.
Mm-hmm.
And however, some of the other symptoms, like hearing voices, the voices
Mm-hmm.
are extremely critical and negative.
Mm-hmm.
And it actually, I'm talking with the client and I go, oh, you know, your internalized voice sounds exactly like your emotionally abusive mother.
Right. Yeah. Right.
And
Mm-hmm.
or these wild swings of emotion, if a child is exposed to traumatic and terrifying events, they can't regulate their emotion because
Mhm.
children are fundamentally dependent on their parents in infancy
Absolutely.
to
Mhm.
learn how to regulate their emotion. But if mom is totally emotionally unavailable and dad is just drunk on the couch, the child doesn't learn how to regulate their emotions. No wonder they have these wild spikes up and down.
Right, because we get so many cues from life in an early age from our caregivers, and we learn so much about the world and how to navigate it and who we are and what our place is through those relationships. And if they're absent, it's like there's no feedback. Like,
Yep, yep. So
mhm.
one of the questions that comes up is, how do I heal from these psychological injuries? And there actually is real hope. So, and this, I mentioned this in my TEDx talk. You can just go onto YouTube and plunk my name in, it'll pop up. And you can
And
find
I
this.
have a link for that as well on my page, so I can share that as well.
Yeah. So what they did is all these refugees come streaming out of the Middle East. They wind up in Germany. These people had been through all sorts of trauma.
Mm-hmm.
They'd seen their homes bombed. They'd seen their brothers shot. They're fleeing war. And so all these German psychologists say, well, golly, we got all these camps full of traumatized people, let's help them. So they go out there, they measure their DNA, and they find that these people have as many breaks in their DNA as people exposed to an atomic bomb.
Wow.
Yeah, mind bending. And so they take all these people and they split them into two groups, and they tell one group, okay, we'll treat your trauma right away. And the other group, oh, sorry guys, you got to wait 5 months and then we'll treat your trauma with psychotherapy. And of course, all these people have PTSD symptoms like crazy, nightmares and
Mm-hmm.
re-experiencing and, flashbacks, the whole kit and caboodle of symptoms of PTSD. And then they treat the people, they take half the group and they treat them, and they discover that, lo and behold, their symptoms get better, right? Their flashbacks stop, the nightmares stop, their hyperarousal calms down, and they take blood samples, they analyze it. Their DNA is now just as healthy as people who have never experienced any trauma. So, and then they look at the other group and they are just as messed up as ever. And, their DNA is just as broken. They've got just as many symptoms. And even the ones taking, what we call psychiatric drugs like antidepressants and antipsychotics didn't have any impact. It was psychotherapy. And so the thing that's really helpful for healing psychological injuries is to find a psychotherapist that you've got a good sense of teamwork with.
Mm-hmm. Mm-hmm.
Because psychotherapists are just like every other profession. You got some that are absolutely amazing. You got a big chunk of people that do decent work, and then a small group that are just frankly toxic. And
Yeah.
it's just what the research says, Alana. And
Well, no, I had someone tell me that their therapist told them, "Oh, maybe life isn't for everyone." And I was shocked and heartbroken, really.
Yeah.
Because here's the person going for help because they feel so, and also had a huge history of trauma and suicide attempts, and that's what their therapist told them. And it's so heartbreaking because a good therapist can make such a difference. And, I've struggled myself, like therapy, I hadn't had very much success with therapy throughout my life. And now I have a wonderful therapist, and it's changed my whole view on therapy because I have somebody who is giving me what I need and
Yeah.
that I feel like really sees me and is on my team. and is rooting for me. And wow, what a difference. But it did take me till, 40 years to find somebody that is going to be a really good fit. So,
Yes.
absolutely. If your therapist is not working for you, then don't stay, and don't blame yourself for it not working, because you're just going to, my experience is if you're in a therapeutic situation that's really not serving you or helping you, it's going to cause more harm, because you're going to think, well, not even therapy worked, and now there must be something really wrong with me because that didn't work either. No, it could just be the skill of your therapist and that you haven't found the right fit.
Yeah. And one of the things that also significantly improves the quality of therapy is if the therapist measures, what's the person's level of psychological distress,
Mm-hmm.
and what's the person's sense of teamwork with their psychotherapist.
Mm-hmm.
Because the sense of teamwork that the client feels to their psychotherapist or their psychologist, that sense of teamwork is the single most important factor. And,
Mm-hmm.
Alana, I'm just a flawed human being. I screw up sometimes with my clients. And what's really helpful is that when I hand them that sheet for them to mark the sense of teamwork, they now have a way, they mark me lower. And I look at
Right,
it and
they
go,
can give you that feedback.
yeah,
I think that's so important. And I've had not just therapists, but I've had other professionals sort of give me their assessment of me that didn't always feel true.
yeah,
And it created some challenges in my life. And so now, like, I'm not a therapist, but I do coach people on their mental health. It's always turning it back to the person to say, did that help you? Did that make a difference for you? If you think about the original issue, does it feel any different? And if they say no, then I go, okay, we need to look somewhere else, because that didn't shift it for you. And the goal is for you to feel better. And if you don't feel better, then we're not on the right track,
yeah.
which is, I mean, this is what we're talking about, is also such a far movement away from sort of what we were talking about before, which is the diagnostic model of, like, let me label, oh, you have this issue or that issue. Like, I had a friend and she was talking about going to therapy, and the therapist was telling her, oh, you have relationship addiction issues. And I just saw her, like, crumbling, because she's
Hmm.
already in a fragile place. She'd already had a huge amount of trauma in her life. And so now she feels worse about herself and that she's even more dysfunctional. I'm like, oh, honey, I'm so sorry, because
Yeah,
it didn't really help her. And just going on with what you're saying is those labels and those, like, here's how you're broken. My experience is it just makes people feel more broken and more discouraged that they're ever going to get help, versus, like, wow, you've been through a huge amount, and it makes perfect sense why you're feeling the way that you're feeling. And I totally get it. And I'm here to help you to see that and to have a place to heal from it. And it's such a different sort of mentality and approach to how we address a client or deal with their mental health.
Alana, what you said was just so perfect back there. And that's why therapy heals. Therapy heals
Mm-hmm.
because it conveys to the client that the client is, respected and cared for. That's the
Mm-hmm.
exact opposite of what the perpetrator did to cause the psychological injury in the first place.
Right. And when you get out of the diagnostic model, then you're recognizing that, like, no, you're not just broken and screwed up. What's really going on here is you've been hurt,
Yep.
and I'm going to give you care,
Yep.
which is such a different framework almost. And I'm going to repair the harm that happened to you, and repair, because most psychological injury, would you agree, is the source of, maybe not all, but a lot of it is the source of other people's treatment of you or other people's interactions with you.
Oh, yeah. Yeah.
And so
And
to have a healing one is so valuable.
right. And
Mhm.
that's why, stepping away from diagnosis and saying, here's the list of my psychological injuries on my index, that's the focus of therapy. And then the therapist looks through it and goes, wow, you've been through some very painful experiences. And, let's
Sort of.
focus on helping you to heal from them. And then a therapist will check in with the client. Does this approach make sense for you? Is this helpful? And again, that's the opposite of what causes
Mhm.
psychological injury, because
Mhm.
Uncle Wayne just did what Uncle Wayne wanted. He wasn't asking his 8-year-old niece what she wanted. But a good therapist will be checking in with the
Mhm.
client and saying, is this a good fit? Did something shift for you? Was this helpful? Right? And then the client can give feedback.
Absolutely. Yeah.
Now it's teamwork and collaboration in healing psychological injuries. It's not somebody slamming something on you.
Right. It's finding that place of empowerment, because so much of trauma is an experience of being a victim or disempowerment. Now you're getting your power back to have agency in the experience
Yep.
instead of have it be something done to you. And sometimes therapy does, in certain models of therapy, it does feel like your therapist is trying to do something to you. And most of the people that I know that have dealt with a lot of trauma and also suffered from depression are really wary of going to therapy precisely for that. They don't want to be labeled. They don't want to be put in a box. They want somebody to care. They
Yeah.
want somebody to care about them as a human being. And that fear of, I don't want to be diagnosed and thought of as crazy or weird or screwed up. I just want somebody to care about my pain. And
Exactly.
that is so huge. Well, I'm sure we could keep going for hours. I mean, we both love this subject, I'm sure, and have so much more that we could talk about on it. But so just to recap, what we're talking about is that mental health disorders really, by and large, come from trauma sources. And that if you start to shift the way you think about what's wrong with me or why do I have all these symptoms to what happened to me that I'm trying to navigate and trying to cope from and trying to heal from, then it's a very different approach and it's a very different perspective. And how you can navigate that is very different. And from your research, it sounds like really that's where the difference in the results occur, that people heal and get better and overcome things like depression, bipolar disorder, when they focus on healing from the pain of what happened to them rather than trying to figure out how to make their symptoms go away.
Yeah. Yeah.
Well, super. So again, can you give that away as a psychological index.com? Is that it?
Yeah. Psychologicalinjuryindex.com.
Okay, so that's where you can assess your own psychological injury and take a look at what you might be struggling with, what events might have occurred in your life that are causing some distress. And then the step from there is to really seek out a resource that's going to help and support you. This is part of my work as well as Dr. Eric's work, but to help you understand what's really going on for you, where those mental health conditions are stemming from, and then how to really work with and heal them. And we didn't talk a lot about the stuff that I write about in my book, but I do cover a fair amount of how your childhood experience affects your mental health. And so if you're wanting to check that out, you can get a free copy of my book at findingyourownhappyguide.com. No, sorry, findingyourownhappybook.com. I knew I didn't say that right. And that will give you also some practical tools to start working with your experience and shift your experience. And again, I am here every week doing this show, talking to different professionals on different unconventional sort of viewpoints on mental health and happiness and how to create shift and change to truly heal and truly find your own happy. So please come back again next week, Tuesday, 6:30 p.m. Pacific time for my next guest. And do you have anything that you want to share in way of closing for our conversation tonight?
Well, first of all, thanks so much for hosting this, Ilana. And I just feel honored to be able to communicate to the public. You're not fundamentally crazy. You know, you don't have a brain disease. You don't have a chemical imbalance. You're in pain. And it's not surprising you're in pain. You know, once you go through and look at, hey, what are the different psychological injuries I've experienced? And it might take you a couple of tries to find a therapist that you have a good fit with. I just encourage you to carry on with that journey and to get the healing that, you know, you deserve after the very painful experiences that you've been through. So, you know, really hope that this helps the public and, you know, serves you, whether you're listening to this live or on the replay.
Yes. Thank you so much. It's been a pleasure talking with you tonight, and I look forward to more conversations in the future.
Thank you.